In this video by Deck Plate we will be discussing ankle conditions. Some of the most common ankle conditions experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Ankle conditions mostly diagnosed in veterans during military service. Veterans go through rigorous training and physical demands during active duty or active duty for training, which includes frequently carrying heavy gear for long periods of time. So, ankle conditions are common and they can lead to the development of other issues such as disabilities of the feet and of the knees. So, today, we will be breaking down some common ankle conditions that we see in veterans. Lateral ligament ankle sprain. A lateral ligament ankle sprain occurs when the ligaments outside the ankle are stretched beyond their limits. Injury to these ligaments causes pain and swelling in the ankle. Generally, most sprained lateral ligaments are minor and will improve with simple treatments. However, severe cases can weaken the ankle, leading to repeated lateral ligament sprains and chronic ankle pain. Causes of lateral ligament ankle sprain. A lateral ligament ankle sprain occurs when the ankle rolls inwards or twists. Generally, your ankle twists during activities such as walking or running on uneven surfaces, playing sports involving a change of direction, or an unexpected fall. Usually, the more times you sprain your ankle, the more likely you'll sprain it again. Diagnosis of lateral ligament ankle sprain. Lateral ankle ligament sprains are routinely diagnosed using a clinical assessment and diagnostic imaging. The clinical assessment should be carried out by a highly experienced physiotherapist and includes an interview and a physical assessment. The interview is designed to reveal how your pain started, whether this is the first time you have experienced an ankle injury, any previous trauma or pathology in the leg, from the hip to the big toe, and what aggravates or eases your symptoms. The physical assessment comprises of close inspection of the foot and ankle, assessing for swelling and bruising, structural assessment of your ankle and foot, including assessing the quality of the arch of your foot and ankle joint range of motion. Inversion and eversion are of particular importance when assessing lateral ankle ligament sprains. Calf muscle strength testing. Can you complete a heel raise? Balance testing. Can you stand on one leg and maintain your balance? Palpation, feeling, of the ankle joint and the surrounding soft tissues. This is used to locate the source of your pain. It can be painful but helps to formulate a diagnosis. Functional testing including walking, single leg balancing, hopping and running may be assessed, if appropriate. Your history and a thorough clinical examination will determine the severity of your sprained ankle. If required, you may be referred for a X-ray, CT scan or MRI to confirm or exclude specific ligament or bone injuries. Deltoid ligament sprain. One type of sprain, a deltoid ligament sprain, is specifically an injury to your inner ankle. While it's not common, it's still painful and can incapacitate you for quite some time. The deltoid ligament, also called the medial ankle ligament, is one of many ligaments in your ankle. Causes of deltoid ligament sprains. Deltoid ligament sprains are an uncommon type of ankle sprain. A strain or tear of the deltoid ligament results from rolling your ankle inward, pronation. The medial ligament is stronger than the lateral ligaments. This strength makes it less likely to strain or tear. Deltoid or medial ligament sprains account for only about 15% of ankle sprains. Most injuries to the deltoid ligament result from a direct impact to your ankle. An ankle fracture, broken bone, on the outside of your ankle is the most common cause of a deltoid ligament sprain. Diagnosis of deltoid ligament sprain. Your doctor may be able to diagnose a deltoid ligament sprain based solely on a physical examination. To get more information about the extent of your injury, though, or ensure that there are no bone fractures or other underlying injuries, they may also order imaging tests. MRI. To get a better look at your ligament injury, your doctor may use magnetic resonance imaging. An MRI combines computer-generated radio waves with a magnetic field to provide 360-degree views of the internal organs and soft tissues within your body. X-ray. X-rays use focused radiation to produce images. On an X-ray, things that are dense, like bones, appear white. Your doctor can use an X-ray to check for fractures or other bone problems that might be contributing to your injury. Anterior or posterior ankle impingement. Ankle impingement occurs when either soft or bony tissues are compressed within the ankle joint at the extreme end of a motion. Ankle impingement is a condition that causes a painful limitation of ankle range of motion due to a soft tissue or bony abnormality. Causes of ankle impingement. Anterior ankle impingement occurs due to repetitive stresses at end range positions of the ankle, such as when one jumps, squats or descends stairs. It is also common among participants in sports such as football, dance and gymnastics. Posterior ankle impingement is caused by compression of soft or bony tissue between the shin bone, tibia, and the heel bone, calcaneus. It is common in athletes who sustain forced plantar flexion, bending down at the ankle joint, including ballet dancers, runners and soccer players. Symptoms of ankle impingement. The symptoms of ankle impingement can vary depending on which type a person is experiencing. With anterior ankle impingement, symptoms can include pain on the front and or outside of the ankle joint, A feeling of ankle instability. Decreased ankle range of motion when stretching the toes up. Pain at the end range of stretching the toes toward the shin. Tenderness at the front of the ankle when touched. With posterior ankle impingement, someone may experience pain on the back of the ankle, especially during activities that involve pointing the toes down. Decreased range of motion when pointing the toes. Tenderness on the back of the ankle when touched. Diagnosis of ankle impingement. In most cases of ankle impingement, diagnosis will start with a physical examination of the ankle. A doctor will also most likely discuss the person's symptoms and general health history. To provide a definitive diagnosis, the doctor may also order imaging tests such as X-rays or MRI. Ankle tendinitis. Tendinitis involves an inflammation of the tendon. Ankle tendinitis, then, can simply be defined as an inflammation of the tendons of the ankle. Tendons attach the muscles to the bones in your body and help you to move, as well as acting as an important shock absorber. Causes of ankle tendinitis. Ankle tendinitis is often caused by overuse of the tendon. This can occur because you play a particular sport or your job involves manual labor. In other cases, tendinitis can occur as part of the aging process, which makes them more prone to stress. Symptoms of ankle tendinitis. The main symptoms associated with ankle tendinitis are pain in the affected area, difficulty with moving the ankle joint, swelling, a crackling sound when moving the joint. However, if you experienced a pop when you injured your ankle, you may have ruptured the tendon, in which case, it's important to see a doctor right away. Diagnosis of ankle tendinitis. Ankle tendinitis can be diagnosed with a medical examination and the doctor asking about their symptoms. However, it is likely that you will not need to see a GP, as most cases of tendinitis can be treated at home. If you see the GP because your symptoms haven't improved after a few months, they may recommend further examinations such as an X-ray or MRI in order to investigate whether the pain is the result of a different condition. Thank you for watching our video. Please don't forget to subscribe and like our videos.